It was nearly 2 years ago that we learned the first case of the coronavirus had been detected in Colorado. Since then, there have been more than 1.3 million cases of COVID-19 and the different variants of the virus. Well, now Colorado is getting ready to start a new chapter and return to a more normal life for people across our state. It was this afternoon that Governor Polis and other state health leaders warned that COVID will be with us, though, for the rest of our lives.
But the governor also laid out a roadmap to living with the virus. And he says if you are fully vaccinated, you are part of the state that can turn the page onto the next chapter.
Now, look, there is no claiming victory with regards to the virus. The virus is here and will likely be here for the rest of our lives. But it is time to acknowledge that we've reached a point in Colorado where Coloradans who are fully vaccinated can freely live without undue fear. So if you choose to go without your mask or attend a concert with your friends or simply go out to dinner and you're fully vaccinated, then by all means do it. Live your life. Don't feel guilty. You only live once.
As the governor said, the guidance going forward for those in the state will be if you have had 3 doses, you should feel comfortable living life as normal. If you are vaccinated but immunocompromised, take necessary steps to protect yourself and find out if maybe a 4th dose of the vaccine is right for you. Those who are not fully vaccinated are still at risk of the most severe issues associated with COVID.
There's many Coloradans who a year ago returned to their regular lives, and there's no shame in that either. They have a different risk profile. But for most of us who try to balance living risks every day, who don't avoid driving cars because we're afraid of car accidents, who don't avoid skiing because we're afraid of ski accidents, in the scheme of all those risks we take, if you're fully vaccinated, the risk of dying or having severe health impact from COVID is very small.
The state will use a 4-step plan to get ready for future surges of the virus. Those plans include preparing hospitals, building up the healthcare workforce, and asking the federal government to take steps to help states get ready for future waves or other viruses. State health leaders say in the future, those who are infected will go to their normal healthcare provider instead of a state-run site to get tested, vaccinated, or treated for COVID.